It's like you have to shove them up so high.
You do.
Hello, everybody. My name is Elspeth Meisner. Thank you so much for joining us for our COVID-19 roundtable, where we're bringing in the experts all locally to answer your questions about COVID-19. Joined with me today, we have Jamie Babiak from LECOM. She is the Director of Operations and Pharmacy at LECOM's Institute for Successful Aging. We're also joined by Dr. Becky Dawson, our Erie News Now contributor and epidemiologist. We also have Stephen Henderson. He is the Director of Pharmacy at AHN St. Vincent. And lastly, from the Erie County Health Department, we have Charlotte Beringer. She is the Director of Community Health Services. So all people who have been answering all of our questions throughout the entire pandemic, and they're all joining us today to answer your questions that you still may have about COVID-19. So thank you all so much for being here with us today. So we're going to start out with a question for everybody. What are your initial thoughts about how we stand as a community with COVID-19 in our area? Jamie, we'll start with you.
Sure. I think as a community overall, we can do a little bit better as far as vaccinations go. I do see a couple first and second doses picking up as we're pushing out the boosters and things, and I think maybe some exciting things to come with, different approvals for boosters and for children. So I think we have some room for improvement in that as far as that goes.
Dr. Dawson?
Yeah, so I think that unfortunately we're behind the average of the country. We're still seeing cases rise, we're still seeing hospitalization rise, and we all know that the mortality will follow that. So I think that we need to recognize that while the country may be coming down from what we call this fourth wave, we are still really in the midst and kind of in the heat of a really significant wave of disease, and with combining that with low vaccination rates and our kids still being unable to get vaccinated, I think there's still a moment of pause and concern.
And to elaborate on that, at this point, really what's driving a lot of the spread that we're seeing in the community that's translating to hospitalizations is that group of unvaccinated individuals in our community. So our focus at this point, while we are rolling out boosters to those groups of authorized individuals, we can't forget about the groups that are still unvaccinated, because that's going to be an important key moving forward to continue to slow the spread and combat this disease in our community.
Right. And we know from a disease reporting perspective, the first 9.5 months of 2020 compared to the last 9.5 months of 2020, from when the pandemic started, to the first 9.5 months of 2021, we actually had several thousand more cases in 21 than we did in 20.
And that's an interesting point. It's going to kind of move us on to our next question. Let's compare where we were a year ago today to where we are now. Yes, we have vaccines, but also we're still seeing high case numbers. Your initial thoughts on that, Shar?
We're not at all surprised about the high case numbers, because our vaccine rate is low in general, yet alone compared to the rest of the nation. And there's a CDC recommendation that we be wearing masks in public places. I don't see a whole lot of masks in public places.
Yeah, and we were talking earlier, how we're kind of handling things as it relates to physical distancing, lockdowns. That is a huge difference this year compared to last.
Yes.
So can't just look at it, last year in the absence of vaccines compared to this year with vaccines. There's so many other things that helped combat spread of the virus that are not in place right now.
Right.
This time last year, I think the term COVID fatigue had been introduced and we were all feeling it, and I think that now COVID fatigue is it's not just escalated, it's like on speed. I mean, it really is a real thing. And I think that it's really challenging in the midst of a lot of fatigue, wanting this to be over, to recognize that individually we can do some things to stop the spread of disease, but this really has to be a community effort. And so we really need to think about partnering and coming together as a community to get vaccinated, to wear our masks, to keep that distance.
Yeah, I would agree, with what everyone has said, and especially with what Steve said of, what was in place last year versus what is in place this year. I certainly think, we're kind of in a similar position. This time last year was when we were mostly affected by COVID-19, and while there may not be as many hospitalizations or deaths, they are still there, and there's, the cases are still there. So I think we certainly have, room to do better there.
And let's talk about one of the things that's changed a lot is the fact that we now have vaccines. For a lot of the vaccine clinics that we've been seeing sponsored by AHN, LECOM, even the health department, are you still seeing people getting their first doses all these months later, or is there more of a need for the booster shots, people wanting those booster shots?
There's definitely, I think, we've seen a lot of booster shots, a lot of people interested, a lot of the third doses when those first came out for both the Pfizer and the Moderna. We have a trickle of first doses. It's, I think, all about at this point just combating some miscommunication and providing education on individual concerns and barriers.
And how about for AHN?
Yeah, I think, Jamie alluded to this. At this point in the game, education at venues such as this is so important so that we can, as the healthcare community, provide the accurate messaging to the community and combat some of that mis and disinformation that may be driving some of these, rates that we're seeing as it relates to, vaccine hesitant individuals. So education's great. Being able to come out and participate in a discussion like this is great for our community to get the facts from trusted healthcare providers, and something I think we need to do more of too, to kind of steer people in the right direction if they are part of that vaccine hesitant group.
But the good news is that over the last week, we have had almost 2,000 people accept either their first or second dose.
Oh, that's great.
So that's
news.
encouraging.
Absolutely.
Should be celebrated. Definitely should be celebrated.
Let's talk a little bit about people who might be fully vaccinated, gotten both their doses, and they're exposed to somebody who has COVID-19. There's a lot of miscommunication out there, misinformation. What is their quarantine time for being fully vaccinated but still being exposed to somebody?
For someone who is fully vaccinated and exposed, they don't have to quarantine as long as they don't have any symptoms. If they have symptoms, they absolutely need to quarantine. They need to get tested. It's always recommended that close contacts to confirmed cases get tested. And it's the same for quarantine people, because we know that there is breakthrough disease. So test anywhere from 3 to 7 days after exposure. But if you remain without symptoms, be masked for sure. Be masked for 10 to 14 days. Really be masked for 14 days, especially with Delta. But you can go about your life versus being quarantined at home.
And fully vaccinated means you've received that first shot of Johnson & Johnson or those first 2 shots of Pfizer or Moderna, and that appropriate time frame after the second dose has elapsed. So I can't have my second dose yesterday, be exposed today, and be considered fully vaccinated, because our bodies need time to build that immune response that ultimately protects us from COVID.
Yeah, good point. You need that extra 2 weeks.
Sure.
Let's also talk about something that's been in the news time and time again is pregnant women and the vaccine. Should they get vaccinated? Women who are breastfeeding, should they get vaccinated? Let's clear up some confusion about all that.
Go ahead.
Go ahead. You know vaccines very well.
This is a concern that we have heard a lot over the last 10 plus months. Early on there was a lot of mis and disinformation out there in social media indicating that receipt of one of the mRNA vaccines could potentially cause increased rates of miscarriage, infertility, those types of things. Well, we can say 10 months, going on 11 months into this vaccination campaign, hundreds of millions of doses being administered. There's a lot of robust data now that shows that these vaccines are extremely safe. I mean, these are some of the most studied vaccines in the history of vaccines. And the data shows that these vaccines are extremely safe in pregnancy and actually provide, a benefit to both mom and baby. If you look at 2 healthy individuals who don't have any underlying health conditions, one is pregnant, one is not, and they both develop COVID, pregnancy in and of itself is a risk factor that sets somebody up to have a more severe disease and a worse outcome. So we need to make sure that women of childbearing age, and especially women that are pregnant, are receiving the vaccine, because it keeps them safe, it keeps baby safe, and ultimately it's the best thing for them and baby.
And I think from a biologic standpoint too, the misinformation is all built around this rumor that, one of the proteins that is in the mRNA vaccine matches something that is in the uterus. And I think that, again, kind of going back to maybe even high school, college biology, is that, our body is built of a lot of amino acids that then go to form proteins. And if you think about it like a phone number, right? Like we all probably have a shared digit in our phone numbers here, but if you call my phone number, you're gonna get me, you're not gonna get Shar, even though we both might have a 2 in our phone number. So if we have a protein that has an amino acid in it that is shared between one in our uterus and one that's in the spike protein in the vaccine itself, it doesn't mean that our body can't recognize that. Our body and our immune system is wicked smart. It knows how to recognize and distinguish between individual proteins, individual amino acids. And so I think that we need to remember that things may on the surface, oh my gosh, there's a shared amino acid. That does not mean that our body doesn't know how to deal with that. That shared amino acid is just one little part of a protein that's put together, and our body knows how to respond to each of those 2 things. So I think, I don't know, the rumor and I think the misinformation around that, we really need to work to clear up, because it really is just like a telephone number. We share digits, but our telephone numbers are unique. In the same way with, we share amino acids, but those amino acids form really, really different proteins, and our body knows how to respond and what to do with each of those proteins.
Stephen, you said something interesting about these vaccines being so widely studied and researched and everything. If they're so widely studied, why do we still see a lot of hesitancy from people who want to get the vaccine in today's day and age?
I think part of it is, I think it's a there's multiple pieces to that answer. I think a lot of the hesitancy is surrounding how quickly they came to market. A lot of people misinterpret that to be that the steps in study and approval were rushed, when in fact that's just not true. What's unique about development of these vaccines compared to other pharmaceuticals is, whereas steps in the process typically happen sequentially, one after the other, development of these vaccines happen in parallel. So you had ongoing studies, phase 1, 2, 3 studies, while the manufacturer was manufacturing. Typically that's not the case. The manufacturer isn't going to put their eggs in the basket and mass manufacture their product before it's approved by the FDA. But in this case, they were able to do that, which is why they came to market so quickly. So I think that's one of the reasons that folks are a little concerned about these vaccines. At this point in time, as you mentioned, they're so well studied at this point. Some of the most studied vaccines in our history, but that's one of the reasons I think there are folks that are still hesitant.
I think we use we do use different words too. Like when you when you go to get the flu vaccine pre-COVID, or you went to get your meningitis or whatever you went to get, no one was talking about vaccine technology or what technology, like all of a sudden we started using different words because, one, I think we were all interested and we were all living through a pandemic, and like that was the news cycle. And I think, vaccine technology has been a thing since we introduced vaccines in the 1940s, but we never put that word to it. And I think it just changed people's attitudes and understandings, and it opened the door for a lot of new questions and a lot of room for, well, let me go dig down a rabbit hole of, research on my own that, probably isn't what we had expected. And I think that vocabulary has really changed around vaccines, which has made people really anxious about, well, should I put technology in my arm? And I think that that's been really challenging.
Especially when you're talking about mRNA, something that's a novel way of providing therapeutics, let alone vaccination. This is something that's never been done before. So just hearing mRNA, DNA, technology, those are kind of buzzwords that may turn some folks off. But if I may just kind of quickly describe how the Pfizer and Moderna vaccines work, think of it as a set of instructions, a recipe, if you will. That recipe, the mRNA, goes to your cell. Your cell has little pieces of equipment in the cell that acts as kind of the chef, right? It reads the recipe, which is the mRNA, and creates the end result, which is that spike protein, which your body then sees as a foreign piece of material and sees that and mounts that immune response. So it's just a different way of being able to provide an antigen or a foreign material into our body, like we do with the flu vaccine on an annual basis. It's just a different way of delivering that antigen, if you will, but as has been shown, very, very effective and very safe.
And what a lot of people don't realize is the technology, this mRNA technology, actually started being researched 10 years ago.
Yeah.
Around coronaviruses. There have been other coronavirus epidemics, not pandemics. SARS, MERS, they were both coronaviruses. So the research has really been in process for a decade already.
Let's talk a little bit about booster shots. It's been a big talker these past few months. Why is it important for somebody who is eligible to get that booster shot, get that extra layer of protection? We'll start with Jamie.
Sure. I think we're seeing, we know there's a certain level of antibodies that your body has, which is why we do our flu vaccine every year. But I think specifically with these vaccines, there's going to be this resurgence that we're experiencing. And if we can make sure that our antibody levels and things are up just like they need to be, along with, the approval process, then I think that's important to get us through the rest of this pandemic.
And I think we're seeing that in the community. I mean, for many folks that were vaccinated at the beginning of this effort have now hit that 6, 7, 8 month mark. Mm-hmm. And those are the people that we're potentially seeing these breakthrough cases in. Many of those folks are of advanced age or maybe have some sort of underlying immune condition that may have prevented that initial immune response. But I think just a gradual waning of immunity is what is certainly helping to contribute to some of these breakthrough cases that we're seeing in the fully vaccinated folks, which, again, moving into respiratory season where we're indoors, and especially, moving towards the holiday season where we're going to be gathering, certainly having that additional boost at this point in time for those folks that have met that 6 month mark and meet the criteria for a booster shot is certainly a good idea at this point, I think.
It's also just an opportunity to say, take a friend who hasn't been vaccinated and say, I'm going to get my booster shot, come with me. I think there's, some sort of community effort, and also if you go first and they go after you, I think that it opens the door for conversation, but also that camaraderie about going to get your first shot or your booster shot.
But there's really not a recommendation for boosters for everybody at this
Correct,
point.
right.
And I think a lot of people don't understand that. The recommendation for the boosters is for the people who are at the most risk of hospitalization or death from disease.
Right.
And at this point, we're not going down that rabbit hole of boosters for everybody quite yet.
I know a little bit earlier we talked about making sure you are fully vaccinated is 2 weeks after you get that second dose. But with booster shots, when are you the most protected from it? Is there still a time period or a window after that you're the most safe and secure?
Yeah, you still need to wait that period of time for your body to have that immune response to confer that that protection against COVID.
And kind of going off that as well, for the booster shot, is there anything different in a booster shot compared to that original dose, or that first or second dose, or is it just getting that same shot? I know there's a little bit of confusion between a booster shot and a third dose. Could you clear up some of that confusion for us? We'll start with Jamie.
Sure. So the third doses were introduced for those immunocompromised individuals, and there were several categories, most of which I think if you are presented with immunocompromised individual for whatever reason, they're eligible for that third dose, which actually doesn't have to be 6 months after that second dose. Mm-hmm. It's within 30 days of that second dose, so they would qualify for that. So the booster dose is now approved for the Pfizer, like we talked about, for the healthcare providers, those at higher risk, congregate settings, things like that, but 6 months after that second dose.
And just to kind of clarify a little bit from that, so once somebody gets a booster shot, is it the same makeup, same formula as those first 2 doses then?
Yes, it is.
For the Pfizer, yes.
For Pfizer.
Yeah, that's the only one that's approved
So
right now.
again, that is the only booster that is approved for 65 plus in long-term care facilities, 18 to 64 with underlying health conditions, or in a high-risk occupation such as healthcare workers. So those are the only individuals who qualify for a booster of Pfizer at this point. Last week, the FDA reviewed data on Johnson & Johnson and Moderna boosters, and we anticipate some additional kind of activity this week with the FDA and the CDC. Mm-hmm. It could be in the next couple of days that we hear about authorization and recommendation of boosters for those vaccines, but we're not quite there yet. I know there's a lot of confusion. Mm-hmm. It's very complex keeping all of this straight. Speaking from us healthcare providers standpoint, we certainly appreciate that it is a lot of information and a lot to keep straight, but we're not quite there yet with Johnson & Johnson and Moderna for boosters for that same category that I talked about. Mm-hmm. Jamie indicated that third doses of Moderna are acceptable for immunocompromised individuals.
And like you said, there is certainly a lot of news every day about more things being approved by the FDA or going to different panels to get approved. How exciting is it just to know that there's a lot of ways for people to stay protected against COVID-19, and there's so many opportunities. What's it like, to be hearing all this, new news every day about it? Dr. Dawson?
No, I think it's super exciting. I think the hard part, the past couple of weeks has been hard because it has felt very unfair and unequitable that people who got Pfizer are now getting boosted, and people who got Moderna and Johnson & Johnson are like, what the heck? So I think I'm looking forward to the end of this week. I think that that's what they're aiming towards in terms of, Moderna and J&J. So as exciting as it is, I think that we've also brought about a lot of confusion, given that it looks like the different groups are going to be able to, if you've got J&J, you're going to be able to get boosted if you're in different groups than Moderna and Pfizer. So I think that, we have a lot to kind of like navigate through. So it's super exciting. I think it's great in terms of disease prevention, in terms of decreasing disease spread, getting more people vaccinated, but it does bring in a lot of confusion, and I think a lot of individual decisions, but also understanding of, what your route is based on what vaccine you got originally.
And I also know, Jamie as well, Stephen, you work with, pharmacies and getting people vaccinated. What are some most common questions you're getting from people as they're looking to get vaccinated?
I think as the new information comes out, like we said, that is very confusing. So the third doses versus the boosters, what do I qualify for and when, I think is some of the biggest questions. I think, as the boosters come out for Pfizer and the third doses, what are those side effects going to be? I know a lot of people had some significant side effects with second doses. So those I would say are the most common, other than the ones you get about the microchip and the different doses, like you said, of which one am I getting for second, third. So oddball stuff certainly, but those are the most common ones I think we've seen.
Yeah, I agree. The reaction question is one that I get the most. I had a bad reaction to my second dose. Should I expect one to my third dose? So we are getting a lot of those questions from the individuals that we're vaccinating. Mm-hmm. Yeah.
And I'm sure, Shar, at the health department, you get a lot of interesting questions as well. What are a few of the big talkers, that you still get time and time again, even months, a year and a half into this pandemic?
In relation to vaccine, I think they've been pretty clearly stated. People want to know what's appropriate for them, when. They're unhappy, with the Moderna and J&J people that they're not there yet. But you have to remember, Pfizer came out first too. So that 6-month time frame for Moderna and J&J is going to be further down the road than it will be for the people who've had the Pfizer vaccine.
And Pfizer is our big gun. I mean, the majority of doses that have been administered in the U.S. have been Pfizer. So there's that bigger sample, more data to be able to support these ongoing efforts to provide additional authorizations.
Right.
So yeah.
And let's continue with booster shots. What's the time frame, if you're eligible to get a booster shot, that you can receive your booster shot for it? What's that time frame? And after that time frame, once you go past it, is there a certain part that afterwards you're not going to be as healthy, as safe? Let's talk about that time frame for it.
So as it relates to how quickly we as vaccine providers can start administering boosters, speaking of Johnson & Johnson and Moderna, as soon as the CDC signs off on the recommendation, we're actually required to start administering those booster doses as soon as possible. As it relates to the time frame for which you should receive that booster dose, don't want to speak specifically to what that recommendation will be for Johnson & Johnson and Moderna, because we don't quite, we anticipate that we know what that will be, but I don't want to kind of confirm that before it happens. For Pfizer, as Jamie indicated, 6 months after your second dose, you can receive that booster of Pfizer. And there's no, cutoff time as it relates to how far out you can go. As time goes on, those recommendations certainly will evolve. Will this become an annual booster? Yet to be determined. It's kind of looking like it could go that route, similar to flu. But yeah, there's no cutoff as far as, it's 12 months past my second dose, I can't receive a booster now.
So even if you are 8 months after you got that second dose, you can still go ahead and get that booster then?
Yeah, and the majority of us healthcare providers who had access to the vaccine right away, most of us were at 8-9 months before we got access to that booster dose. Yeah.
And let's continue to talk a little bit more. We're going to throw in a viewer question that somebody sent us. Somebody said that if they're fully vaccinated, they got COVID-19, do they still need a booster shot afterwards? Will they have more immunity if they get the booster? What's the right way to answer that? We'll start with Jamie.
I definitely think once they're out of that isolation period, it would be a good idea to get the booster. I think that's part of the misconception out there is that, I had COVID, so I am protected. I don't need the vaccine. But certainly I would recommend once out of that isolation period from COVID that if they're eligible for the booster, they would get the booster.
There's not enough data to support that natural immunity is better than immunity secondary to vaccine. So at this point, the recommendation is to receive that booster dose, or if you develop COVID between your first and second dose, after that isolation period to receive the second dose. The only caveat is if you receive a monoclonal antibody or convalescent plasma as part of your treatment for COVID, you do need to wait 3 months before you receive that next dose of vaccine.
We've been hearing a lot about different things to do to protect yourself against COVID-19, the vaccines, but let's talk about some of those treatments that as you had just mentioned. What things, if people are in the thick of it with COVID, any signs of treatment that they can do to help ease some of their symptoms, some of their pain they're going through? Dr. Dawson?
So I think that, this is a virus that we don't have like an over-the-counter or even a prescription that you can go and, like when you get strep throat, you go and get an antibiotic. So I think we need to remember it's a virus and viruses don't respond to, antibiotics. And so, we've been telling people if you can stay home, you're supposed to stay hydrated and stay away from people and wear your mask so that you're not infecting people. And then I think we do have treatments in the hospitals for people who are sick or who qualify for, the different types of treatments, but we aren't at the place yet. I think we're all kind of sitting on the edge of our seat waiting for just, like the federal discussions around the Merck pill. But I think, they're saying that is December, right? That's months off at this point in time. So again, we're trying to get people to prevent themselves from getting sick. I think once we're at the treatment stage or the recovering from disease, we've missed so many opportunities to slow the spread and prevent illness from the start. So I think that worrying about treatment we shouldn't be worried about that. We should be trying to do everything we can to prevent disease spread.
But to take off from the treatment side, the monoclonal antibodies now are actually being used for those who are not hospitalized,
right,
and having very good prevention effects as far as limiting the duration and the severity of their symptoms. So that's relatively new and showing very, very nice results. So if someone is really high risk and they realize that they've just gotten their confirmation, they should really be making sure that their primary care provider is aware of their diagnosis and do that assessment whether they're appropriate to receive that monoclonal antibody treatment.
Right. And time is of the essence with those monoclonal antibodies. They're most effective the earlier you receive them after a diagnosis. So it's important to have that conversation with your physician to help to initiate treatment with that monoclonal antibody. And there are several different authorized monoclonal antibody cocktails, if you will, that are available. I think most health systems kind of stick with one or the other, but there are multiple formulations that are currently authorized.
Can I ask a question? Okay, so this is probably for you guys. So if I don't have a primary care physician, so I go to CVS tonight and I'm really sick and I test positive, but I'm high risk and I don't have a primary care physician, is there somewhere or someplace that I can call or go in order to get this treatment and not have to just suffer at home?
So if your symptoms are bad enough that you need emergency attention, definitely go to the emergency department. But at this point in the game, our health systems are seeing a lot of presentation to the ED. So for individuals who need tested, just because they may have mild symptoms and they want to test, or maybe asymptomatic, we really are encouraging folks to contact their PCP or go to an express care rather than present to the emergency department. But again, if somebody's having severe symptoms, as you outlined, definitely want to make sure they receive that emergency type of medical attention at an emergency department.
And before we get to Jamie's answer in a second, we're going to just get ready for a news cut-in real quick. So for everyone who's watching on Facebook, thank you so much for watching, as well as on ENN Plus and Twitter as well. If you do have any questions, please feel free to put them in the comments below. Anything you have for our experts here. They've been answering great questions so far for the past half hour. Everything from COVID-19 to booster shots, everything you need to know, especially as we're getting closer and closer to colder months as well. So we're just going to get ready for our quick news cut-in, and we'll resume with the questions in just a few seconds. So just stand by with us for 1 second there. Hi, Mike and Eva. We have been answering a lot of your questions that people have been writing in and sending in for the past half hour. Joining me right now, we have a panel of 4 local panelists, all experts with COVID-19. We have Jamie Babiak from LECOM. She is the Director of Operations and Pharmacy. We also have Dr. Becky Dawson, epidemiologist and an Erie News Now contributor. We have Stephen Henderson. He is the Director of Pharmacy from AHN St. Vincent. And then we have Shar Beringer she's the Director of Community Services from the Erie County Health Department. We're going to ask one question here just so you can get a little bit of a look at what some of the questions we've been getting so far. So we're just talking about people who might not have a PCP and where they can go to get some COVID-19 answers. So Jamie, I believe you were about to answer that question for us.
Yeah, sure. Just kind of off of what Steve was saying, if you are sick enough that you need to present to an emergency room with those symptoms, I would imagine that at the emergency room there would be assessments completed to see if you qualified for one of those treatments that we were talking about. So I think, like Steve said, if the symptoms are mild enough that they can be contained like a virus at home, that's obviously the best option. But if the symptoms are most severe, then qualifying for a treatment through the emergency room would probably be the best option.
Well, there you have it, Mike and Eva. Just a little bit of a look at some of the questions we're going to be answering until 6:30 tonight. So plenty of time to get your questions in. We'll be checking with you later in the show as well for another peek into tonight's Q&A. Thank you guys for sticking through that. So kind of continuing as we're talking about booster shots and vaccines, we know there's a lot of different variants coming out. We heard about the Delta variant in the summer. We also heard a little bit of some rumblings about the Mu variant as well. Are the vaccines tailored differently for each of these variants? Do they protect against these variants? How does that work out? And especially if we see more variants on the rise in the future. Dr. Dawson, we'll start with you today.
So I think that, what we've seen, we have a lot of data, and I think that what we've seen consistently with Pfizer, Moderna, and Johnson & Johnson is regardless of the variant, so whether, we were thinking about like early spring when Alpha was there, or over the summer as Delta became the most prominent variant, that these vaccines have been really effective at preventing severe disease, hospitalization, and death. And so that's really encouraging news, and just the reminder that we're not looking for a vaccine to be perfect and to end the pandemic, but really to slow spread and to prevent, severe disease and illness. So the vaccines were not designed with a specific variant in mind, but they've been very effective as we've seen new variants start to evolve and become predominant in our communities.
And you mentioned something that's very important. Just because we are seeing some breakthrough cases in individuals who are fully vaccinated does not mean that the vaccine doesn't work, right? We're still seeing that for the vast majority of our hospitalizations are in those individuals who are unvaccinated, which means that the majority of people who are vaccinated have really good protection against severe disease requiring hospitalization. So again, fully vaccinated, having a breakthrough case does not mean that the vaccine doesn't work. It in fact actually is shown with what we're seeing in the hospitals right now that it truly is working.
And let's talk a little bit about those breakthrough cases as well. For somebody who might have, gotten the vaccine and are suffering from COVID-19, and they might be wondering, why me? Explain a little bit more about why these breakthrough cases are happening and are possible.
Yeah, so I think there's several reasons they could be happening. One, there could be individual with underlying immunocompromising condition that didn't allow them to elicit that kind of full, strong immune response, and in turn, at this point in the game, they're more susceptible, which is translating to a breakthrough case. As mentioned, there is data to suggest that at 6 months and beyond, there is waning immunity in individuals who don't have underlying immunocompromising conditions. So potentially, a healthy individual who's working in healthcare, who's exposed to COVID every day, working on a COVID unit, at this point, without a booster, they may have waning immunity, and in the setting of high exposure, being exposed every day could have that opportunity for having a breakthrough case. Two, at this point in the game, breakthrough cases, what we're seeing is typically older individuals are having those breakthrough cases. So folks that are prone to developing more infection at baseline anyway. So I think there are multiple reasons. There's not just one answer to why we're seeing breakthrough at this point.
Yeah. And I think you hit a key point. With the Delta variant, that is still the predominant variant. And the virus load with Delta is exponentially higher than any of the other versions of the virus that's been out there. So when people are routinely getting exposed to very high doses of virus. But the vaccine can only give so much protection.
And I think, that's the thing here. The vaccine is not this magical silver bullet that provides you with, superpowers to protect you from disease. It is one tool. It's a really effective tool. It's shown to be really great at, all of these things, but it doesn't mean that you can take your mask off or engage in risky behaviors or assume that you are invincible against this virus. It's still there and it's still out there. And so you're vaccinated and you need to be taking other steps to reduce exposure.
And that's not necessarily unique to COVID. I mean,
No.
we see that with flu on an annual basis anyway. There's cases every single year, maybe taking last year out of the equation, but where people are vaccinated against flu and still develop flu. But typically, those infections are less severe because people are getting vaccinated and have that immunity to stave off that more severe infection. So it's not unique to COVID.
And kind of talking about flu, I remember I interviewed you just a week and a half ago about the importance of getting a flu shot. And just in case anybody might have missed that, how many flu cases were reported last year?
14.
14 flu cases.
14 for the entire season.
And obviously, this year, it could be a very different story. So kind of talk to us about the importance of making sure you get that flu shot this year.
Okay. Last year we had the advantage that we were all wearing these masks and we were all distancing, or at least the huge majority of us. So it's a virus that spreads by breathing on each other. This year, there's a lot less masks. We know we're going to see flu this year. And it's going to get really complicating because the symptoms of flu, so many of them are so common with COVID. People can get them both at the same time also. That would be horrible, just from how sick they would become. We know that normally our hospitals during flu season get very busy with flu. Well, right now they're very busy with COVID. And if we add very busy with flu on top of that, it can break hospital systems, quite frankly. And we really do not want to see that happen.
And there is potential concern that overall, with the minimal exposure of our community to flu last year, that could mean that there's less immunity in our community this year, which is another reason why it's so important to receive your flu shot this year.
For sure.
Every year, but especially this year.
Yeah, for sure.
And just kind of going to throw in a different question here, because we just got this breaking news right now that U.S. regulators allowed the mixing of COVID shots for boosters and for Moderna and J&J boosters as well. Dr. Dawson, I know we talked to you just yesterday about this, about the possibility of it, and now it's a reality. What's your first initial thoughts after hearing this?
So this is FDA approval. Is that where we are?
I believe we're at
double check.
FDA. It's just one step. in the
Right, so
process.
it's authorization. So this
Yeah.
means that these guys cannot put shots into your arms tomorrow. So we still need to wait for CDC's Advisory Committee on Immunization Practices to meet, which I believe is scheduled for Friday. And then the director of the CDC will take their advice and then issue the authorization that will allow our healthcare providers to administer those. So this is the first step of what is now 2 additional steps that are needed before those vaccines can be put into people's arms. But we talked about yesterday, so it looks like Moderna is going to have the same booster requirement. So it's going to be our 65 and older, and then individuals who are 18 to 64 who are at high risk because of either their health or because of their work environment. They're exposed a lot. So, but I think the difference is going to be for Johnson & Johnson, where unless they change something from the vote, everyone is going to be eligible for that second shot, was what they were talking about. And so I think this is where we have a lot of things, and now we're going to add the complexity of you can start with Johnson & Johnson and move to Pfizer or Moderna. And so there's just a lot here. And so this is where I think a lot of things need to happen. So number 1 is go home and double check what dose, like what you actually got. Make sure you know where you started, and then move. It's going to be a decision-making tree, and we might need to hand draw it out. How do you move through this? But I think that asking questions, being very open that you want to make the best decision for you and for the community, and then asking, do I qualify for a booster? Should I get it now if I qualify? And then I think now the complicated question is, if I started with this brand of vaccine, should I shift to a different type of vaccine?
And you can continue on, or somebody else can jump in for this one. For so long, we were told to stay on the path. If you were Pfizer, stay Pfizer. Moderna, stay Moderna. Johnson & Johnson, say that. And now we're swapping. Is it just because of more research? Why the change now? Jamie?
I think for the change, I would consider, the crossing of doses a very good backup plan. And I think that's a good plan to have whenever doses like we experienced at the beginning were not readily available. But I certainly think, it would be important to stay within what you have if you have it readily available. I think being in a pandemic, we need to have everything available. So if that is a backup plan to have, if the doses aren't readily available, I think that would be a good plan. But I would encourage, staying with the same vaccine that you have been receiving.
I'd agree with that. There is emerging data that does show that there may be a benefit, maybe even kind of an exponential benefit, if you will, in providing more protection. 1 + 1 = 3 and not 2, potentially, with mixing and matching vaccine manufacturers. But personally, I still feel it's quite early in the game to make that definitive recommendation. I'm kind of looking forward to more experience with mixing and matching and more data to really solidify those recommendations. But ultimately, if the ACIP and CDC authorize the mixing and matching of vaccines, we as vaccine providers will be ready and able to do that, consistent with the recommendations that ultimately are approved by put out there by the ACIP and CDC.
Right. And we're not there yet.
Right.
That's the key.
Yeah, start doing this
Right.
tomorrow.
That's the key.
And I think ACIP, if you look at the agenda for their meeting coming up this week, they're really going to be looking at, okay, how do we provide the best information to folks that started with Johnson & Johnson? How do we provide the best to people who are Pfizer and Moderna? So if we take out supply, and everyone has everything available, I think that I'm hopeful that they are really going to say, this is what we recommend for individuals that started with this vaccine brand, so that they get the biggest impact, and we're not sending missed messages to the public, based on every provider or everyone who has the opportunity to talk about it.
And I know Jamie, as well as Stephen, when you're doing these vaccine clinics, going out into the community, as well as with Shar with the health department, I'm sure, do you get a lot of people asking questions about, well, I had this one, can I get this one now? Have there been questions before about mixing and matching before this was even brought up?
Yeah, there certainly have been some. I wouldn't say a high volume of those questions. Many of the questions surrounding boosters are, I think just given the confusing set of circumstances that we're in with all of the different manufacturers and all of the different authorizations and recommendations being at different kind of phases, just folks not knowing, if they receive Moderna, that they're not yet eligible for a Moderna booster. So that's most of the questions that we receive surrounding boosters. I'm not sure if you guys have a different experience at
Yeah,
WeCom.
I would say the same. There was a handful of questions about mixing and matching, I think, as the vaccines became more readily available, but certainly most of them just kind of, when do I qualify, what's a third dose versus a booster kind of thing.
And let's also, talk as we're going into winter months and everything, and vaccinations as well. How important is it that we still go out into the communities, whether it's rural areas, the inner city, to get people vaccinated and go to them? I know AHN had great success, as well as LECOM, with these mass vaccine clinics at the start of the pandemic. But now, why is it important that we go into these communities now too? Jamie?
I think the vaccine hesitancy, you want to bring everything to be as most accessible to everyone that you can. So I think capturing anyone, with whatever we can do in whatever venue or approach in different areas to capture any more of those first and second doses is certainly a priority.
Yeah, and we've had a lot of experience, as I'm sure LECOM has as well, or just being there at an event or, at a community-based clinic, that people who maybe weren't going to receive the vaccine, just because we're there and maybe are able to answer a question or two, change their mind and receive their first dose in the series. So being there in the community is really important. As things have progressed over this last year, we definitely have transitioned away from that kind of centralized approach to more of a decentralized approach. We're in more and more outpatient offices, outpatient locations, and not just holding, mass vaccine clinics at 1, 2, or 3 locations on a daily basis. So again, providing access at this point in as many locations as possible ultimately makes this this workload as manageable for the healthcare community as a whole, similar to what we see with the flu vaccines on an annual basis. I mean, we're not seeing these mass flu clinics for the most part because you can get a flu vaccine anywhere, and that's kind of where we're at in the game with the COVID vaccine.
And we know that at only 50% of our population, little over 50% of our population fully vaccinated, we know where our pockets are, where the unimmunized, where more of the population is unimmunized. And between LECOM and the health department, we both have mobile units, and we're both targeting those 2 areas that are very specifically under-vaccinated compared to other areas in the county. So some are in the city, some are in the rural parts of the county. But great efforts are really being made, not only from the mobile clinic side and sites within those jurisdictions, but also from the education side. There's actually 10 community health workers that are working in the city with our community centers and working on that whole idea of vaccine hesitancy, any concerns that they have around that. And that's really going to be a big piece of hearing people out, hearing their concerns, talking them through the process, and then once they make a decision, having it there for them.
I know this is a question for Shar, for Jamie, as well as for Stephen. When did you realize with having these vaccine clinics that you needed to change models from going from that mass vaccination platform idea to really breaking it down, going to some of those smaller community events, going to those smaller areas in the city, in the rural areas? When did you realize you needed to shift gears a little bit to make sure people were getting vaccinated? Jamie?
I think probably, late springtime is kind of whenever things started to die down, and, where we were getting 1,000, 2,000, probably some a day. I think now we're certainly getting some, but, every 5, every 1 is a win kind of. But I certainly think, springtime is when we started to dial back, changing venue, changing location, and outreach.
Yeah, and just refocusing that energy and that time spent on those mass kind of centralized locations to that more decentralized approach to hit those folks in those underserved communities or those less vaccinated zip codes and communities.
Yeah, and there have been efforts, very successful efforts towards people who are homebound and getting vaccines out to them. LECOM and other providers have been addressing those folks also. They can't get to the mass clinics, but they have been addressed and will continue to be addressed as these boosters become available.
And why is it important that when you realize you want to get everyone vaccinated, hitting all those target areas, the homebound, the people who might be in rural areas, people who, you know, might not have a PCP that they can go to and they can share that information with them? Why is it so important to make sure hitting all those areas? Shar?
To get through this pandemic, we're all a part of it. So as many of us as possible need to have the right information and choose to participate.
Yeah. Everything around COVID has seemed to become so divisive, but you hit the nail on the head.
Mm-hmm.
We all need to be a part of this solution, and we all have a role to play, regardless of political affiliation, beliefs. We all have a role to play, and I know for every individual that may look a little bit different, but ultimately to bring this pandemic to an end, we all need to collectively work together as a community and do what's right to slow the spread and hopefully get rid of this virus.
It's such a mindset shift, because I think pre-COVID, you know, a lot of our focus on health was very individualized, right? Prevention of cancer, stopping smoking, not drinking, exercise, nutrition. And we put a lot of pressure on the individual to do the right thing. And then we get into this communicable disease space where if you're not taking care of your health, I'm significantly impacted. So I can eat McDonald's every day and I'm not impacting Steve's health at all, right? Like, I'm really hurting myself. But if you're not taking care of yourself and you're not masked and you're not vaccinated, all of a sudden I'm at risk, and I might be at more risk than he's at risk because of my terrible McDonald's habit, right? And so I think that, you know, it really is this shift that we spent so much of our pre-pandemic time, rightfully so, because the leading causes of death were all these chronic, individual, you can change your health outlook by changing your behavior, stopping smoking, not eating McDonald's every day, those sorts of things. That I think that, you know, this has been a huge shift in like how we approach health. That like health is, yes, it's individual, but it's also community. And I think recognizing that my health is so dependent on the actions that people around me take, and that they're depending on me, and the end of the pandemic depends on them as much as it depends on me, has been a really hard change in mindset in terms of like how we actually view, think, and approach living a healthy life.
Absolutely. We're going to get ready for another quick news cut-in. So for our friends on Facebook or Twitter or in ENM Plus that are watching, just hang by for another second. For this next cut-in, if Dr. Dawson or Stephen or Jamie, if you just want to share your initial thoughts to hearing about the FDA approving the booster shots, as well as the mixing and matching.
Pom-poms. Sorry. This is like public health sort of events.
This is Public Health 101.
Absolutely, Mike and Eva. One of the things we were just talking about was the FDA approval for the mixing and matching, as well as for Moderna and the booster shots from Moderna and Johnson & Johnson as well. So Dr. Becky Dawson was just talking about how big this is that we have this new news, especially because we were just talking about it this morning. What's your initial thoughts?
So I think, again, it's, you know, this is step one, and there are multiple more steps that we need to get through before, you know, shots go into people's arms. But this is a positive direction to make booster shots available for everyone who qualifies, regardless of which vaccine you received previously. And that I think, you know, we're all anticipating CDC and the Advisory Committee on Immunization Practices to really provide us with some really good guidance about how and what is the best combination of vaccines moving forward to elicit the most, you know, the greatest immune response each individual can have.
Absolutely. Mike and Eva, we're going to send it back to you, and we'll check in with you later throughout the rest of the show for more updates. Alrighty. Thank you. Okay. Thanks so much, everyone, for joining us for our Q&A roundtable today. We're talking everything from the latest news out of the FDA to booster shots to flu season coming up. And now we want to switch gears a little bit and turn to another big talker, which is vaccinations and children's vaccines as well. Something that a lot of people have been talking about. We can start with Jamie for answering this question. If a parent is unsure about getting their child vaccinated, what would you tell them to put their worries or fears at ease?
I think I would, discuss the initial vaccine series that all children are provided, to start school, and just reinforce those normal practices that we actually probably don't even really think of anymore to send our children off to school, and really just consider the risk benefit of the vaccine versus the disease in their children. And it affects differently. The variants are affecting differently. So I think just talking about the risk versus the benefit of getting the vaccine or not.
Dr. Dawson, anything to add?
Yeah, I mean, and just adding, I think, as we think about our kids, we started this pandemic, really thinking about the elderly and those who are most at risk. And unfortunately, as the pandemic has gone on and on, we've really seen our children being impacted both by COVID and by all of the shutdowns and limitations of COVID. And I think that using this vaccine to both protect them, but also get them involved in this public health effort to end the pandemic is both, I think, emotionally really helpful to be part of the solution, but also will provide them with a great amount of protection. And so, again, I would encourage people who are hesitant to think of the questions that they have regarding their hesitancy and find someone that is trusted that they can ask those questions to. So don't just assume that you have all the answers. Come up with questions and then find someone that you can ask those questions to so that you can be comfortable with the decision to vaccinate your kids.
Yeah, and to your point, this is the way our kids get back to a normal life, a normal school life, being able to participate in person school on a daily basis, being able to participate in sports without fear of games being canceled because of COVID. The other thing to mention is kids, while there may be a lower risk of kids having a severe infection compared to an older individual or maybe somebody that has an underlying health condition, it is still happening. There are still kids in our community who are developing COVID and are requiring hospitalization. So I don't want folks to just think that our kids are resilient. COVID doesn't impact our kids the same ways as adults. And although, in many ways that is true, our kids are not immune to having, a severe infection related to COVID.
Right. Well, and the other thing with children want to be around their grandparents. Grandparents want to be around their children. Children may have it. More children have disease without having symptoms than with adults. It will keep our adult population safer also. It'll be safer for families to be together when the children can also be vaccinated.
We're going to get ready for another quick news cut-in as we're getting ready to start Erie News Now at 5:30 in just a few minutes. So for our friends on Facebook, ENN Plus, and Twitter who might be watching, we're going to take a quick pause. But if you have any other questions, our experts are here. They're ready to answer them. They've been answering great questions for the past hour. We still have 1 hour to go full of different questions that we're going to be talking about. Everything from the latest news out of the FDA, as we're going to be moving to continuing with our conversation about children getting the vaccine and any fears or questions parents may have. Another big topic we're going to be hitting in just a few minutes is all about the holidays approaching and how we should be celebrating safely, how last year looked a little bit different, but how this year, what things parents should be aware of as we're moving closer to the holiday months. Those are just a few topics we're going to be working on in the next few minutes, but until then, we're going to be getting ready for our COVID-19 panel as we go on Erie News Now at 5:30 in just a second. Hi, Ethan and Eva. One of the things we're just talking about right now is children and the vaccines and getting your child vaccinated. We know the White House came out with a plan today to get kids ages 5 to 11 vaccinated. Let's talk a little bit about that. Jamie, we'll start with you. What were your initial thoughts on that?
I think that's wonderful. I think we were kind of started to talk about, engaging this as a full community effort. And I think, although our kids might be impressionable and not quite completely understanding of what's going on, they have been impacted by what's going on. So I think having, the conversation with them and having this as the next step to get more of the population vaccinated is extremely important and very exciting.
And we've already placed our orders for the vaccine for that population. So while we may not be vaccinating the 5 to 11-year-olds for a couple more weeks, we are moving on obtaining that vaccine supply to do so.
Right. And how we care for kids is different than how we care for adults. Kids going back to their primary care provider that they know already, that they have relationships with, will be a much more comfortable experience for them.
Dr. Dawson, anything to add?
No, I think I said before, if you're concerned or you have questions, I think the best thing to do is come up with your list of questions and find a trusted source. You can send them in for the next hour because we will be here. But I think, making sure that you ask good questions and that you get an understanding, because really I think that all of us would agree the need to vaccinate our kids 5 to 11 is imperative, and we really need to aim to get as many as possible vaccinated as quickly as possible as soon as that vaccine is available.
Absolutely. Ethan and Eva, we're going to send it back to you, but we'll be on here all throughout the night until 6:30, and we'll be back on Erie News Now at 6 o'clock as well for another check-in to see what topics we're going to be diving into in the next little bit of time. Let's kind of continue that discussion we were just having about kids and the vaccine. Shar, you brought up an interesting point about kids wanting to see their grandparents wanting to see their kids, especially in today's day and age, when family is so important. Let's talk about, really working together as a community to make sure we're getting kids vaccinated.
Okay. Well, we know that kids are oftentimes don't have symptoms. We know that kids want to be around their grandparents want to be around them. So having kids receive vaccine will just add another layer of protection for the more vulnerable population also.
And I know a lot of the times when you're doing these vaccine clinics, whether it's LECOM, AHN, or at the community health department, I'm sure you might get parents with kids who one child is old enough to be vaccinated, but the other one isn't eligible. Talk about some of the conversations you might have had or some of the questions they might be bringing to you at these vaccine clinics that you guys have been holding. Jamie?
I think really we just, hear, when is this going to be available for the different age group, and obviously bringing a younger child to see either a parent or an older sibling get the vaccine is certainly setting, I think, a good example for something they can anticipate. But I think mostly just when is it going to be available? Is it going to be the same? Those kinds of questions are what we've been seeing.
Yeah, and that was a great point that you made earlier about, receiving the vaccine for this 5 to 11-year-old range in a different setting, maybe like their pediatrician at their pediatrician office. I think what we're going to see with this initiative to vaccinate the 5 to 11-year-olds, it's going to take a different approach. I think there's going to be much more of that community-based vaccination in a primary care office or in a pediatrician office. One, because of the age range, right? It's a tough age to vaccinate, and two, just being in that location, that venue, that the patient feels more comfortable and safe.
We got a viewer question sent in earlier today about kids and vaccine and dosage. And somebody had asked, is it based on the age, the weight, the height? What if you have a, really big, 11-year-old, or a really, really tiny 13-year-old? How do they determine the dosage, and how do they determine when a child is eligible to get that vaccine? Jamie?
So I know the Pfizer vaccine that's ordered for the kids 5 to 11 is certainly going to be different, and I haven't necessarily heard anything, at least not yet, based on weight, but more so just the age range specifically.
Every vaccine is different, right? Flu vaccine, 6 months and up, 6 months to 36 years, you're receiving the same dose, right? Part of the reason that the pediatric vaccines have kind of followed the adult is there's more studies, there's more kind of dose finding studies that go into ultimately their safe authorization, which obviously went into was the case for Pfizer as well. To Jamie's point, 5 to 11-year-olds, it will be a different dose, about a third of the dose of the adult dose. It actually will be a completely different vial than the adult dose. It's the same formulation, it's the same vaccine, but how it's delivered to healthcare providers will be a little bit different. It's going to be diluted a little bit different, but ultimately a third of the dose, same vaccine though.
And I mean, I think this is the beauty of the clinical trial process. And if parents think that like this was rushed, you know, the phase 1 clinical trials were done, they were completed. And what we found was that the immune response of our 5 to 11-year-olds when they got this third of a dose compared to a 12 to 24-year-old who got what we consider like the full dose, they had the same immune response. And so we learned through the clinical trial process that to elicit an immune response in a kid, a younger child, they don't need as much as somebody who's 12 to whatever, the oldest people that we have vaccinated right now. So I think that that's really important. And I think also remembering that like when you dose yourself with like Tylenol or Advil, you're trying to get like systemic, you know, spread of something. And so we do increase it by weight of a child especially. But with the vaccine, what we're trying to do is get that little, you know, message, the recipe, as you called it earlier, into the body so that the immune system can respond. And it's not about like this systemic, we just want the immune system to respond. So I think we've seen like clinical trials have worked, and we need to remember that we're just trying to trigger the immune system, not trying to like have full systemic, you know, treatment throughout the body.
Let's switch gears a little bit. Something that we're getting closer and closer to is the holidays, whether it's Halloween, Thanksgiving, Christmas time, which means a lot of times families are gathering. Let's talk about last year. There's a lot of recommendations coming out if people should gather or not gather. We'll start with Dr. Dawson. Your thoughts about recommendations for gathering this holiday season.
So I think that there's a risk and a benefit to everything that we do, and I think that we need to consider all of those risks and benefits. So as you're thinking about making plans for, you know, whatever holidays you're getting ready to celebrate, I think it's important that you think about who's the most vulnerable person that you would be gathering with. So is it an elderly grandparent or aunt or uncle? And, you know, how can the family protect that individual? So it's not, am I healthy enough to travel, but who am I going to be interacting with, and how can I, you know, protect that individual? So families that are lucky enough to, you know, all be fully vaccinated, they're going to have way lower risk than families with kids that are under 5 that probably won't have everyone vaccinated this year. But I think, you know, smaller groups, you know, making sure that people who are ill or not feeling well don't join the family, even though it might be a very big family holiday dinner or event. Remembering that when you're sick, staying home is really important, and, you know, instituting family washing of hands before all meals is always important, but probably more so heading into flu and COVID season.
Shar, anything to add from the health department standpoint?
Well, especially thinking about Halloween.
Yes.
Now, the beauty of Halloween is trick or treat is the big thing, and it's outside, which is wonderful. We still encourage families to be very creative. Incorporate the mask into the costume. Don't depend on a standard Halloween mask to protect, because it won't. So be ingenious and incorporate the mask. Go out in small groups rather than in large groups. And quite frankly, we really are discouraging the indoor parties for the children that are not yet eligible for vaccine. They're just going to spread it to each other. That's inevitable.
One of the things that we can do to assure that, given the fact that we are going to gather, is that we're gathering safely, is to be fully vaccinated. And there is still time to become fully vaccinated before Thanksgiving. So if that's you and you need your first dose of vaccine to hit that mark of being fully vaccinated by Thanksgiving, to assure that you contribute to a safe family gathering, now's the time. There's no time like the present. Go out and get your first dose today.
Shar, this might be another question directed towards you. Last year when it came to Halloween, we had ideas or recommendations for maybe putting the bowl of candy outside, you know, not having kids come to the door. Let's talk this year. Should people be putting that bowl outside, or is it safe to open the door and have kids grab in? Let's talk about what's safest for this year.
It's actually much safer to have a way to deliver it to them. There are some ingenious people that have actually used a tube and let it go down the chute. I thought it was great. You certainly don't want to invite them into your home, for sure. And it's really best that it be delivered in some other way to them. rather than them reaching into a bowl, for sure.
Dr. Dawson, anything you want to add to that?
No, I mean, that's it. I think that, taking advantage of the outside. So whether you open your garage door, you set a card table up on the table, your driveway, the sidewalk, I think, assuming that the weather is nice, I think taking advantage of that outdoor environment and trying to take advantage of space, creating space, being creative in your yard or your sidewalk, wherever you're handing out candy, is most important. And I would just say the other thing, I'm from Meadville, so everyone thinking about the parade on that Saturday evening. Yes, it is outside, but that is a tight environment, especially in some of those places where people want the good seats for the parade, where all the candy is thrown. I would really encourage people to think about the fact that, masking up for the parade is probably a really wise idea, especially if you have young children who are unvaccinated, who want to be in those crowded spaces, because that's where you get the most candy. So I would just, really encourage people to think about masking at the parade, and I guess it's next Saturday.
But do you guys think it is still safe to be able to go out, do your trick-or-treating and everything as normal, even if they're just taking a few extra precautions?
Yes,
I think so.
it can be done safely.
Yeah. Let's also talk, as we're getting closer to winter months. It's getting colder and colder outside. People are coming inside. What worries do you have as we get closer to some of the more of those indoor gatherings? Dr. Dawson?
I mean, when we come indoors, we do all sorts of things, right? We get close, we share air, we don't open our windows, and we gather in groups and we eat together. That's like what winter is, right? And so I think that, my concern is that Erie is lucky at 50% vaccinated, and you probably don't think that's lucky, but like in Crawford and Warren counties, we're barely over 40% of people vaccinated. And so, when I think about people coming indoors, I think there's a lot of concern about disease spread among the unvaccinated individuals.
Shar, anything you would want to add to that?
That really is our biggest concern. Indoors, the air circulation oftentimes is not really good. Taking masks off to eat, the group gatherings that occur, those are all risk factors for continued spread of the virus, especially for those who are unvaccinated.
Let's also talk, with colder months, more chance for flu season. We're approaching that as well. And we're also talking about more respiratory sicknesses as well. I know we touched on this earlier, but let's really explain more about why it's so important to get the flu shot this year, in addition to your COVID shot. Jamie, I want to start with you?
Sure. I think, with the more relaxed mask wearing and distancing and things like that, I think it's absolutely important to get your flu shot this year. Last year, like we said, we saw much reduced cases of flu, primarily because of the mandated items that we had put into place. So this year, I think with more of a relaxation on that, it's highly more important to get the flu shot.
Stephen, anything to add?
No, and just want to make sure everybody who's watching knows that you can actually receive a COVID shot and a flu shot on the same day. Early on, there was a recommendation to separate COVID vaccines by 2 weeks with any other vaccine. But actually, at this time, it is recommended that you can receive a flu shot at the same time as a COVID shot. So if you go to a vaccine provider or a pharmacy that has both available and you're in need of both, by all means, please take the opportunity to receive both.
Okay. And we know that getting a flu shot will decrease the number of people that need to be hospitalized for flu. It will help keep the pressure off the hospitals that are already under a tremendous amount of pressure. Those providers are exhausted already. You add flu on top of COVID admissions, there's a tipping point somewhere.
Let's also talk a little bit about the flu shot distribution. I know, Shar, the Erie County Health Department put out why it's important to get your flu shot this year. How are we doing as a county with flu shots? And even our local hospitals can answer as well about how they're doing with their flu shot distribution this year. Jamie?
I think ours is probably about average. I don't think it's above average. I don't think it's below average. I think, we've seen some nicer weather up to this point, so I think it's hard to get people in the mindset of the colder months just yet when we're seeing the nicer weather. So I think we're about average as what we are overall for Erie County. I don't know if you guys have a good number of...
We don't really have good data on who's getting flu vaccine. And LECOM, to their credit, for decades in this community, what is now taken over by LECOM, has provided the community flu vaccine. And with the widespread availability now in doctors' offices, in pharmacies, it's just so readily available that we're really hoping the uptake will be substantial this year.
And let's also talk a little bit about another viewer. We're going to throw in a viewer question right now. Another viewer sent in this question: how soon after receiving a flu shot can you get a booster? Is it the same thing that you can get them both at the same time? Jamie?
Yeah, like Steve had said previously, they both can be on the same day. Obviously, you know, the risk may be not understanding which side effects go to what, other than maybe some arm pain. But certainly on the same day, if it's available and you want to, that's an option.
And let's also talk a little bit about where many people are back to work now, back in the office. We still have some people still working from home and everything, but for the most part, people are at home or out in their places of work. Why is it still important to be still being 6 feet apart, still wearing your mask, even if you are vaccinated, by even putting those extra protection barriers in place? Dr. Dawson?
Well, I think, you know, we started this by talking about like where we are in the midst of the pandemic, and our region of the state is still seeing increased number of cases, hospitalizations, and death. We are kind of still in the throes of this fourth wave, and Delta is still, I don't know, ravaging, you know, the community. It really is a big issue. And so, as we've talked multiple times throughout the pandemic, we have to take a layered approach. And so being vaccinated is one super important layer, but it's not the silver bullet. You need to take multiple layers. And so if you're back to work and you're vaccinated, masking when you're in, especially in crowded spaces, if you can go and close your door in your office, that's a different, you know, different situation. But if you're in that environment where you're with, you know, more than a couple of other people, you want to mask up, try to keep as much distance as possible. If you're able to open a window and let fresh air in, I mean, it's beautiful here right now. So I think we need to remember that the way through this pandemic is through layered approaches, that we all need to be taking each of those layers and putting them into practice.
We can even use us right now as an example, still wearing our masks, endorsing that we are vaccinated, just putting those extra layers of protection in place for everyone to keep all of us safe here as well. Shar, we're gonna also have you, if there's anything else you want to add to that answer about why it's so important that we do put all these layers of protection, even if we're going out to a grocery store, going out to dinner, or even running into a quick store to even pick up a few items. Why is it important?
The beauty of that layered protection is every layer adds a certain more degree of protection. Put all those layers together, and they really do have an impact.
Let's talk a little bit about hospitals and doctors' offices being busy with people coming in who might think they might have COVID-19 symptoms. They might have been exposed to somebody. How busy are you guys seeing, whether it's your vaccine clinics or even your respective hospitals, about people coming in with COVID-19? Jamie?
I definitely think we still, you know, within the nursing home world of things, we certainly still have, you know, a COVID unit open, because that's a need for the hospitals to send, you know, patients in need of skilled nursing. So I certainly think it's still there. We're still seeing the hospitalization, still seeing those needing, you know, some rehab and some skilled nursing care. So I definitely think it's still there, you know, as far as that goes. So that, you know, might be here for a little while to come.
Yeah, we're still testing a very good deal. As Jamie, you know, indicated, we are still seeing a moderate to high, depending on the day, presentation of COVID in our emergency department that translates to admissions. So we're still definitely seeing this in our hospitals, certainly. And you know, I think it's still going to be a little bit before we're kind of out of the woods. But again, those mitigation efforts are really key to assuring that this surge does subside, right? And just as it relates to your point on workload, one of the things I just wanted to mention, because it is our profession, Jamie, this week's National Pharmacy Week, and I think at many points it's under-recognized how key of a role pharmacy and pharmacists and pharmacy technicians play in public health for our community. Not only do they provide, you know, accurate dispensing of medications to our community, but they also provide vaccines, the flu vaccine. Now they're providing COVID vaccines and testing. So they are really heroes at this point in time of the pandemic, and I think many times overlooked. So just wanted to, you know, tip my cap to pharmacy colleagues in the community because your efforts are definitely recognized.
We did need pom-poms.
Yeah, we did. It's been a great day, a lot of celebrations and everything. Stephen, you brought up an interesting point, and it's kind of going to segue into our next topic here about the frontline workers. They have done a phenomenal job since COVID first, came into our area. Let's talk about the stress and strain that's been really put on them the past year and a half, and is there an end in sight at all for them?
The end in sight, I think, is the end of the pandemic. So as soon as we can get to that point, that truly is the end. But our healthcare teams are super resilient. They are just awe-inspiring, honestly. The amount of resilience that they have demonstrated and the care, the compassionate care that they continue to provide to our patients, especially our COVID patients, a year and a half into this, it truly is inspirational. So certainly recognize all of the frontline healthcare workers' efforts, but just not healthcare workers, frontline workers across all industries really do need to be paid some recognition, I think, getting up, going to work, and keeping the gears grinding every day.
Jamie, I know you're in the healthcare profession as well. What's it like, to see your colleagues, see people you work with every day, even yourself go through the day after day and not knowing when it's going to get a little easier?
Yeah, I think every small win is very exciting, as far as, one more person got a vaccine, one more person, is no longer having any kind of symptoms. I think every little thing is a small win that needs to be celebrated, because I think, there's so few of those lately sometimes, and I think we need to make sure that our healthcare workers, and as Steve said, all frontline workers are greatly appreciated for their efforts, because, even just wearing the equipment that they have to wear is exhausting day in and day out. So doing that on top of taking care of the patients and not knowing what's going to happen because of the unknown right now still that we have, I think is very important and worthy of recognition.
Dr. Dawson, you're an epidemiologist. When you decided to do this as a career, did you ever think that you'd be studying COVID-19, learning about it, teaching it, and really being in the throes of a pandemic when you first, decided to pursue this?
No, I think, my interest in public health really began with interested in how our environment impacts people's health, and that included infectious diseases and mosquito-borne diseases. And when you're in public health school, you do take a pandemics class, outbreak investigations and everything, but it always seemed like something that may happen, right? And you knew may happen, could happen, but the fact that it actually has, become a thing, and it has thrown all of us, right, into the spotlight in a very different way than I think any of us anticipated when we went to work at the Erie County Health Department. This isn't what you had expected, when you teach epidemiology, you expect to inspire students and, not be on the news. And so I think it's really kind of changed the trajectory of all of our lives in very meaningful ways, but also made us, at least for me, it has brought me back to why I became interested in this, why I love the people that I work with within the public health community, because we all share this very deep commitment to seeing our community be as healthy as possible. And right now that is, standing up and saying we need to take this layered approach and decrease disease spread.
Yeah. And Shar, let's also talk about the health department. 2 years ago, many people, might have heard of the health department, might have, learned about them a little bit. But now hearing us, having news releases, people seeing about it on the news day in, day out. What's your thoughts about, the health department in general and the importance of it? Now, did you ever think, again, that you'd be spearheading going through a pandemic during our entire county?
Let's put it this way. I've been doing public health a really long time. Yes for outbreaks, yes for epidemics. This is honestly the first pandemic in the almost 40 years that I've been doing this. What has become really, really important for our staff is self-care. We have to remind each other to drink. We have to remind each other to eat. We have to remind each other that there's only so much overtime that you can do. You just got to get out of there, and you got to be able to unwind and separate yourself, because that's the only way we're really going to be able to stay with it in the long haul. And we are definitely in it for the long haul.
And let's talk about, those frontline workers as well. and we'll have everyone answer this question. What's your message to the frontline workers? Stephen, I know you said something with the pharmacists earlier, but to everyone from the nurses in the ICU to the PAs and doctors' offices, even the doctors still performing surgeries day in and day out. What's your message to those doctors, Jamie?
I think all healthcare providers, I mean, down to our, housekeeping staff, our dietary staff, our maintenance staff, those are the ones that make the day-to-day functions move for our patients. It's certainly the clinicians, and it's certainly all of those ancillary folks. And I would just, want to tell them that their efforts are greatly appreciated. They do not go unnoticed. And like Shar said, this is kind of a marathon. This is not a sprint, and we're certainly in it for the long haul, and we appreciate those that are there right there with us.
Dr. Dawson?
Yeah, I think thank you is like at the top. I mean, people really, and I think you hit it on the nail on the head. Like, it is everyone from the volunteers that sit at the front desk that tell you where to go when you walk in, to the cafeteria staff that are, providing meals for the hospital staff and the patients. I mean, all the way up to the top at the admin level. Just thank you. This has been unprecedented, unexpected. I think when we started hearing conversations about like a virus and that was changing and causing people to get sick, no one could have expected this. So I think thank you is a big issue, and I think you've inspired the next generation. We know that applications to nursing school, medical school, public health school are off the charts right now. I mean, huge impacts, and people call it the Dr. Fauci effect, but truly it is the effect of all of our workers and all of the healthcare and every part of healthcare that really have inspired this next generation to want to be part of creating healthy communities. And I think that there's no greater reward than inspiring someone else to do what you want to do and carry on your legacy.
And to Jamie's point, really within a hospital, there's so many more caregivers than just the nurses, the assistants, the PCAs, the physicians, the pharmacists, EVS, environmental services, central stores, central processing. All of those members of those teams play such a critical role in assuring that our hospital operations are maintained, ultimately to be able to provide the best care to our patients. So just thank you to everybody for getting up, getting out of bed, coming to work with a smile on your face. And although you may not feel that, you're up to it that day, you put your mask on and you put your smile on and you just happily go about your day and take care of our patients. Again, it truly is awe-inspiring and amazing and remarkable what I've seen out of our healthcare teams, in the recent past, but also we'll continue to see in the future. So just a big thanks to everybody who's been involved in hospitals, but caregivers across all, healthcare industries across the spectrum.
Yeah.
Shar?
Certainly many thanks to every physician in the acute care facilities and our long-term care facilities.
Yeah.
They have really borne the brunt of this. Our emergency responders, our first responders are also bearing a huge brunt on it. We can't say enough thanks to all of them.
As we're continuing throughout this entire pandemic, we're knowing the big question remains what comes next. Once we finally get out of this pandemic, and right now with vaccines, it's great that we have options: Pfizer, Moderna, Johnson & Johnson. Do you think there'll be a time when there's only one vaccine offered, or do you think we'll have all three for the foreseeable future? And if there is just one, which do you think would it be and why? Jamie, we'll start with you.
I think there's still things that are being studied as far as, the top three that we're talking about, Moderna, Pfizer, and Johnson & Johnson. There's still some things out there, so I think there's a lot of unknowns in that, even what's to come with what's already being studied. So I think, just anticipate some more information on what is to come.
Dr. Dawson?
Yeah, I don't think there's any way to predict that future. I think that, Pfizer has gotten its licensure for people who are 18 and older, so they have a different long-term trajectory than the other vaccine providers, but I think it's just a matter of time before Moderna and Johnson & Johnson go through that process as well. So I think, again, paying attention and making sure that you have your questions ready so that you can ask them, because I think things are going to continue to change as we kind of cycle through whatever the next part of the cycle actually is.
Yeah, so not only the vaccine, the prevention front, I anticipate that, these manufacturers will be around similar to flu. There's multiple manufacturers of flu vaccine. and we use those different manufacturers on an annual basis. So I would anticipate the same would be true with COVID, but there's no saying definitively what will happen in the future. So that's on the prevention front with vaccines. There's going to be, I think, a lot of continued movement and advancement in the realm of therapeutics. We're talking about the Merck oral option that is being, was submitted for authorization and review by Merck to the FDA. I think there will be other therapeutics, whether it be a treatment or, other monoclonal antibodies that potentially come to market that can prevent severe disease after somebody does test positive. So I think there's a lot that is still kind of in the pipeline that we'll see come to fruition in the coming months or even years. I think the only thing at this point with regard to our vaccines and our therapeutics is the only thing that's I think consistent and that we should bank on is that there is going to be continued change.
Nothing stays the same.
Right.
Change is the usual.
Yep, that's true.
Yeah, we need more data to see whether it's more important for one certain vaccine over another to stay viable. But yes, it's quite typical for any of the vaccines that we have out there to have multiple manufacturers.
Let's talk a little bit about the frontline workers. How have the first ones in the ICUs caring for those severe COVID-19 patients, but then you're at typical doctor's offices too. How have they had to adapt, or how have you had to adapt and change the way you care for your patients in a different level? And talk to me about what it's been like to change a little bit that way.
I think as far as, the long-term care realm of things, I think not only are our frontline workers the caregivers for the patients, but they're also the family. Because there was a very long period of time where family and visitors were not allowed in the buildings. We have volunteers that were, not allowed into the facility. So I think not only, are they changed by what they have to do for their workflow, their workload, where they can eat lunch, where they can go to the bathroom, but they also now have to be the patient's family members as well to meet the needs of the patients.
Anybody else want to add to that one, Stephen?
Just all while wearing, PPE for an 8 or 12-hour shift.
Exactly.
That's one of the big visible changes that has contrasted with, this time, say 2.5 years ago, is just the prevalence of PPE everywhere in the hospital. Because, right now, hospitals are still locations where masks are mandated. So, there's always PPE present in the hospital right now, whether it be in the lobby or up on a COVID unit. Varying levels of PPE, obviously, but always present.
And it's rare that so many hospital staff have really had to be up on proper donning and doffing of personal protective equipment. It's a whole training cycle that needs to continue as new staff comes in.
Well, we're going to take one final break here, and we're going to get ready for our final news cut-in, and then we'll resume for another several minutes until we get ready for, as we finish up our roundtable, going till 6:30. So for those watching on Facebook, if you still have questions, please let us know. Drop them in the comments below. We've been answering questions for the past hour and a half now, all great questions from you guys. Everything from booster shots to mixing and matching the news out of the FDA. So if you have more, please be sure to drop them below too. Hi, Mike and Eva. We've been answering questions for the past hour and a half, everything from the latest news out of the FDA with booster shots and mixing and matching to talking about healthcare workers. So one of the things we're just talking about right now was the strain that healthcare workers have been going through and all the different things they've been tasked to do. So our next question that we're going to be talking about is with all these healthcare workers, day in and day out, how they had to adapt their daily routines in work to make sure they're still caring for their patients. Jamie, we'll have you answer this one.
Sure. So I think certainly, we talked about the PPE and the things that the staff have to put on all day. They're limited in what they can do, where they can eat, where they can go to the bathroom, and then certainly changing the way that they provide care for the patients, whether that be a COVID patient or a patient that's, in their care for whatever other reason, being that everything to that patient all in one, especially when visitors and things aren't allowed.
Absolutely. Mike and Eva, we're going to be answering questions until 6:30, so if people still have questions, they can put them on our Facebook page or Twitter page to have these great experts answer them. They've been talking all for the past hour and a half about a lot of different topics, so we will send it back to you. Okay. So kind of continuing where we're talking about the weight that these frontline workers have been carrying on their shoulders, let's also talk about the different ways they've had to adapt, even with telemedicine, to doing video calls, video chats and everything. But they all do this to still care for their patients. Talk a little bit about that. Stephen?
Yeah, so telemedicine, from the standpoint of AHN, has always been kind of a part of our strategic plan to scale up and to really build into the hardwired framework of how we deliver care to our patients. Pre-COVID, we were doing a very small number of telemedicine visits. I think in August or September, we had one of our peak months, and we were providing tens of thousands of visits on a monthly basis. So it really just contrasts with how we were pre-pandemic to where we are now. And I anticipate that to be part of how we deliver healthcare permanently, being able to provide the same or better quality of care to individuals who may not be able to physically be present in our offices or locations where we're physically located.
I know we talked about this a little bit earlier, that we're talking about how these frontline workers have inspired other people. Have you seen in any of your realms of work more people wanting to enter the medical field, people wanting to volunteer if possible, people going from nursing to say, I want to be a PA, I want to be a doctor? Have you seen a lot of more interest in the medical field since COVID started? Jamie?
I would certainly say, not necessarily, and only because we haven't seen as many students and things like that as we normally would have. I certainly would say people that are not doing, depending on their job, if my job's in administration or as a pharmacist, doing things and others doing things that are not in their realm of possibilities just to help out. So I certainly think there is probably an underlying desire there. I haven't personally seen it just because I think, that atmosphere that we would normally have students and people engaged to do that is missing, quite frankly, right now. But I certainly think everyone that has pitched in to do things that are not their job is certainly prevalent.
Dr. Dawson, I know you teach as well. Have you had kids say, I want to become an epidemiologist, I want to study this as well?
Yeah, I joked at Thanksgiving last year that what I was most thankful for was that most people didn't think I studied the skin, because epidermis, it's actually epidemic and it means something, right? Which I think is funny, but it really was a reality for me that no one was questioning what I did, because before it was behind the scenes, right? And it was, yes, we might have seen a foodborne outbreak, but it affected, 20 people at a picnic or at a restaurant, and it was different. So, yes, I think there's a lot of students that are coming to, college visit days and everything you have an epidemiology class, I want to be an epidemiologist, or I'm thinking about health education or community nursing, and all of these things that I think, existed pre-pandemic now have names for them, which I think is super exciting. And I think also we recognize that people who run small businesses need to be thinking about public health. And so there's this interchange between, well, I want to open a business of my own, but I need to be thinking about health regulations and maybe infectious diseases and not, keeping my workers safe and healthy as well. So I think it's been really exciting. And I think that, there is data that says that medical school, nursing school, and public health school, really, they've seen off the charts applications over the past 18 months.
Stephen, anything to add?
Just, if there's any viewers who are interested in the healthcare profession, please reach out to one of the local health systems and inquire. Part of our job in healthcare is kind of leading folks and training the next generation, right? And part of that is recruiting folks to the healthcare field. So if anybody out there is interested in a profession of epidemiology or pharmacy or nursing or studying to become a physician, please reach out to one of the local health systems and inquire, and I'm sure we can get you in touch. for either, you know, an observation opportunity or just have a conversation with somebody.
And every bachelor's nursing program has a whole semester on community health. And I think that will get a lot more attention now and hopefully bring more young professionals into it.
Yeah. Let's talk a little bit about your concerns as the pandemic continues to linger on. Could there be another wave in the future? What are your concerns as we're, like we said, going into colder months and there's still not an end in sight in the near future? Jamie?
I think, you know, kind of like we have said before with, you know, saying about having a layered approach, I think if everyone is personally responsible, you know, for what they are they vaccinated, are they not vaccinated, are they going to a gathering where there's an older adult, a new infant, are they exposed to something normally that they really maybe shouldn't be, and they should really consider the surroundings and the circumstances in that. So I think taking personal responsibility for that, as well as encouraging folks, and maybe it is bring a friend to a booster day or whatever it may be, to continue, because we do have a ways to go to work through it. But I think if everyone is responsible for that, I certainly think we can, because we don't know really what is to come.
Anyone else want to add on to that one?
I'll add on to that one.
Okay.
From a public health perspective, knowing how many people, not only in our county, our state, our nation, the world, are still unvaccinated. Viruses mutate. That's what viruses do. That's their normal function. If Delta kind of dies down and a new variant comes out that is resistant to vaccines, we'll be back to square one. And that's really the public health concern, is that the variants will continue with the added risk of somewhere along the line. One of them, the vaccines might not give nearly as much protection.
And that's a great point. I mean, the forecasting over the next several months and into the spring is encouraging. It shows that by spring, we should have this as a country under control, but that isn't factoring in a potential new variant that has yet to be named. So again, that just highlights the importance of getting folks vaccinated so that we decrease the opportunity for the vaccine to mutate and form a new variant that's not impacted by vaccines.
And kind of going off that, when you talk about springtime, you know, having, as a country, having it under control, do you see our situation improving anytime soon in the near future? What's your, I'll use the word you use, the forecast on it. What's your thoughts on that? Jamie?
I certainly think, you know, if we continue to do the boosters, and if we continue to push and really educate and tackle those misconceptions on the vaccines, and continue to work honestly person by person over the vaccine hesitancy, I think we can improve. And I think probably, you know, the community amount of cases is probably a little bit, you know, able to scare folks into, you know, that we're not really through this, if that's maybe what it takes to really think that this is still here. So hopefully we see the trend heading downward as we tackle all of those things.
Dr. Dawson?
So it's really hard to forecast because this is based on everyone's individual behaviors and what every decision we make, literally every decision that you make when you like leave your house is impacting whether or not and how fast, and whether there'll be evolution of the virus, and whether we'll see a decrease or an increase in the number of new cases. And so I think that, you know, right now we're dependent on our community coming together and really focusing on these layered approaches to decreasing disease spread. And so if you want to see the pandemic end, if you're fatigued and tired and like looking forward to non-mass, governed type of holidays, you know, the answer is really simple. Go get vaccinated, plan to get your kids vaccinated, wear your mask for the next couple of months, and, you know, be thoughtful about gathering in small groups and washing your hands. And I think that, you know, those type of decisions are going to help us get to the end faster. It's not going to magically happen. We're not just going to snap our fingers.
Stephen?
The last couple of months, we've certainly gone in the wrong direction. Have we done everything that we need to do to get things moving in the right direction? You know, I'd say for the whole of Erie County, no. We need to get more people vaccinated, and that's a message that we need to continue to tell the community and we as vaccine providers need to be willing to and able to provide additional vaccines for those who are unvaccinated. So to the point of the other panelists, if we can get our community to that same mindset of doing what we need to do for the public health, community health perspective, and not just what John Smith thinks is best for him, then I think we'll be able to get this under control much more rapidly.
Yeah.
Sure.
I rarely try to forecast in public health. I always say my crystal ball just doesn't work. But we know that these layered strategies that we have talked about repeatedly in this panel really have the most potential to positively improve things related to the pandemic.
Stephen, you had an interesting point there about us going into the wrong direction, but also the importance of taking care of our community and moving forward as a community as well. Let's talk about the different ways. We've seen different companies, different people putting out incentives to get the vaccine. We'll give you, you could win this, you can, get a free this. Do you think these incentives are working when it comes to people getting the vaccine? You can answer, and then we can show it. Bring it around to our other panelists as well. We'll start here.
I'm not quite. So AHN and the organizations that I'm affiliated with have not incentivized vaccines, so I'm not directly familiar with the impact that incentivizing vaccination. But it is our expectation that our healthcare workers and the patients that we serve, do the best thing for themselves and seek out vaccination.
Moving on to another question, kind of in each of your roles. Since you all have been on the front lines of the pandemic since it first began, what are the biggest lessons you've learned about each of your roles, or even about yourselves, since we first started the pandemic in our area back in March of 2020? Jamie?
I certainly think in my role, I think it's taking a lot of internal and external collaboration with other healthcare partners, other healthcare systems. Not something that I was unfamiliar with, but certainly something that we all do rely on each other a lot more than normal. And there's things that within internally that I think challenged everyone. Very much educational experience and things that. As part of a COVID command center, I probably never thought that I would be doing in reviewing policies for donning and doffing as a pharmacist, or whatever it may be that I am doing, and I have a personal interest now because I feel like if I can do one more thing to impact that or change that or educate more, I think it's important. So certainly just maybe some growth, learning experiences, and more collaboration, I think, as a community as a whole.
Dr. Dawson?
I've learned to say I don't know a lot more than I had before. And I think a lot of people have asked, what is your crystal ball telling you? What can you, and I have a few people that I share personally, what I think might happen. But I think that, recognizing and the lesson that I've learned is that my education, my thought process as a scientist, has to be explained, because science is evolving just like the virus evolves. And so having the time to explain, being thoughtful about my words, and being ready and willing to say either I don't know or what I said last week is not the case. We've learned so much. I mean, my first panel here, I think, was in March of 2020, and we weren't wearing masks then. And we actually said, there's no indication, there's no data to support mask wearing in the community. I said that, literally I was in this seat and I said that. And, but, within 2 weeks or 3 weeks, I had to come back and say, okay, we didn't understand this 2 weeks ago. Here's what we've learned over the past 2 weeks. And we need to now change, right? I mean, that's the nature of a pandemic, of science, but it also needs to be a way of thinking, of understanding, and of approaching an evolving problem and evolving crisis in our communities. So I've really had to learn a lot of humility, but also how to explain that humility, communicate it with others, but also be very clear on, as of today, with the best information we know, these are the things that we need to be doing to stop the spread of disease.
Stephen?
I think the biggest thing I've learned is that we all have broader shoulders than I think we give ourselves credit for. We're able to take on a lot more, and it's really easy to say, yeah, I'll do that, yeah, I'll do that. But equally important is establishing, a work-life balance and creating that opportunity for resilience so that we don't deal with the burnout that we're seeing in the healthcare community right now. The other thing that Jamie hit on is just being able to build, our professional networks and being able to collaborate and partner with individuals and groups that we haven't partnered with in the past. So that's been really, really compelling, I think, to me, being able to build relationships that were not there prior to the pandemic.
Okay.
And Shar?
Flexibility and collaboration. It pretty much echoes what we've said. I remember doing a training last summer with school districts, and it's like, this is what we know today. It might change tomorrow, literally, but this is what we know today. So we all really learned how to roll with the new information. Public health has always recognized the need to work with partners, and it's been certainly even more heavily emphasized. We've been telling businesses that public health does impact your business, and that wasn't really understood until this came about. It's well understood now.
Look at the global supply chain.
Yeah. and how many businesses were impacted, how many jobs were lost. We're all in this together.
I couldn't have said it better myself. We only have a few more minutes. We're going to take a few viewer questions now. Somebody had just messaged us on Facebook asking, will children ages 5 to 11 require 2 doses of Pfizer, and how far apart will they need to be scheduled? Jamie, we'll start with you on this one.
Yeah, as far as we know, I believe, 2 doses similar to the adult. Like we said earlier, it won't be the same dose, but the same timeline of the 21 days will be there for the child dose of Pfizer, assuming everything is passed and approved as it's sounding like it may be.
Dr. Dawson, anybody else want to add on to that one? We're going to wrap things up with a few more questions. What is your message to the Erie community about the current state of the pandemic? What message do you want to get across to our viewers? And we'll have everyone answer this one. Jamie?
I think, one of the things that I certainly would say is, I think some vaccine hesitancy does surround, political and personal beliefs. And I think that's something that we all need to, be sure that we're hearing out from people that have them. But I think, certainly nobody wants anyone to get a vaccine because the government's telling you to do it. I think you have to do what's best for you and your community, whether your community is your home, your workplace, your Erie community. So I think, taking those things into consideration, as far as what we don't know about vaccine, mandates to come or whatnot may be, I think we have to do what's right for us, our families, and our communities. And I don't think that, I think that's something that we have to have open and, unbiased opinions about, and I think any one of us would be happy to do that for anybody that would have questions.
Dr. Dawson?
Yeah, I think that my message would be, I understand and I share the fatigue, the exhaustion, the frustration with whether it be masks or quarantines and having, not being able to go to school or work, or the uncertainty or just the continual news cycle around COVID. So it has been hard, and I think I understand and appreciate that hardness, but just because something's hard doesn't mean that we can ignore it. And this, we still are in the middle of a very significant surge of cases, both cases, hospitalizations, and deaths. And, it's sort of like, it is like running a marathon, right? You can't quit. The finish line is ahead of you, and unfortunately, we don't know how long ahead of us it actually is. You can't see it. So even in the middle of this fatigue and this frustration, it's all the more important to really think about layering your approaches, mitigating disease spread, taking responsibility for you and your family. And I think you said it really well, because we want a healthy community. And again, whether a community is your family or your work community or the Erie community, or shout out to Crawford County, the Crawford County community, we want healthy communities, and we all need to be a part of this race to get through the pandemic.
Stephen?
I think you mentioned something that was worth repeating earlier. If you're out there and you've been vaccinated, you have a role to play in having conversations with individuals who are surrounding you. Maybe those are family members, maybe they're friends, to have that conversation about why they may not be vaccinated, what hesitancy they have. And to Jamie's point, if there is support that's needed in answering questions and combating some of that mis and disinformation from healthcare providers in one of the health systems here in Erie County, we're definitely there to support you in those conversations. But back to the point that was made earlier about we're truly in this together. That means every one of the viewers here in Erie County has a role to play, and that may be having a crucial conversation with somebody who's unvaccinated, who's close to you.
And Shar?
I can't add anything to that. That's really what it comes down to. We all play a role in getting this. I agree, Becky. I'm tired of this. I have definitely have some COVID fatigue myself. There is no doubt about that. But it is a marathon. And I would challenge those who don't understand vaccine well yet to ask those questions. Ask those hard questions. Let us provide the answers. Trust the science is what it comes down to.
Yeah, and I think that there's something about answering questions that's really important. So just because you have a question, going online is not I think there's something there that is lost in translation, right? There's something so valuable about having, whether it's telehealth, whether it's calling someone, whether it is the face-to-face meeting. And I would just really encourage people who have questions not to default to the internet, because there is huge value in the person-to-person. I think that, medicine and clinical care is all about caring for the one-on-one, being with someone and actually engaging in that. And the internet can't provide that to you. So if you do have questions, I would really, as part of this challenge, really encourage you to write them down and find someone to actually talk to, not just to think, well, I can do the research on the internet.
I want to thank you guys all for taking the time to answer all the questions that we've compiled, as well as people online that have wrote us in, whether it's on Facebook Messenger, even Twitter. If we didn't get to your question and you still want it answered, please send us an email, put a message onto our Facebook page, and we'll try and get it answered. We've been so grateful to have these wonderful panelists to answer your questions for the past 2 hours, everything from booster shots to flu shots, to the news that we heard while we were right here about the FDA approving mixing and matching vaccines, as well as booster shots for the Moderna and the Johnson & Johnson vaccine as well. So thank you guys all for taking the time. Any last words anybody wants to add or wants to say before we wrap things up for tonight?
Just wait for the ACIP and CDC to make those formal recommendations on boosters, because we can't start administering those yet. So a few more days, we think.
Yeah, there you have it. So we might have gotten the news right now, but just still wait for a little bit longer if you're looking to get those booster shots or to mixing and matching them. And as always, if you have any questions, please send them our way. We'll do our best to have these wonderful experts answer them for you. Thank you all for taking the time to be here with us this evening, and thank you for always answering all of our questions that we may throw your way as well. I really appreciate it.
Thank you.
Thank you.
And thank you so much everyone for watching and for tuning in online as well.